In continuation with our malaria parasite topic, we have body causes. Now, the main cause of the malaria is due to the bite of a female mosquito, which is the Anopheles mosquito. This is the main cause of the malaria parasite. For the kinds of the parasite, we have four kinds, and they are more or less Plasmodium parasites, which are the Plasmodium ovale, Plasmodium vivax, Plasmodium malariae, and Plasmodium falciparum. For all of these kinds, we have the Plasmodium falciparum, which is the most severe one. It causes severe illnesses and even leads to death. This is the one that we need to be very careful of, the Plasmodium falciparum. Well, the next is the means of transmission. Yes, of course, it is being injected through the proboscis of the female Anopheles mosquito. However, there are means of transmission since it deals mainly with the red blood cells or with the blood cells. One of them is one of the means of transmission is through shared needles. Of course, when you share needles or sharp objects such as razors, there might be traces of blood on that thing. So when you transmit one blood from a malaria patient to a non-malaria patient, of course that individual is at risk because the blood is going to be mixed with the normal blood, making the normal blood to be infected with the parasite. Of course, another means of transmission is through organ transplant. Organ transplant also deals with blood. Since once the trace of the malaria blood has mixed with the non-malaria, of course you are going to have it. Then next is through blood transfusions. That one is common. Next is signs and symptoms. How do we know that? What are the outward signs that someone has malaria? One of them is headache, chills, also fever, high fever. It could be high, it could be low. It could also lead to diarrhea, vomiting also. So these are the signs of malaria. Next, we have diagnosis. It is diagnosed in the lab, of course, through blood samples. The blood sample shows the presence of the parasite. This is how it's diagnosed in the laboratory. Treatment. Well, the treatment depends mainly on the type and the severity, the age, or if the patient is a pregnant person or not, if the woman is pregnant or not. So this is how treatment depends. Well, some medications are chloroquine, atovaquone, procaine.